The moral issue of artificial insemination. Artificial insemination consists of depositing a man's semen in the vagina, cervical canal, or uterus with instruments like syringe to bring about conception unattained or unattainable by sexual intercourse. The process may be either intravaginal, intracervical, and intrauterine. There are several methods of extracting semen for artificial insemination purposes. First is masturbation after a short period of abstinence from ejaculation, 3 to 12 days. The quality of semen is improved by a short period of abstinence. Second is condomestic intercourse. Third is coitus interruptus. Fourth is anal massage of the prostate gland. And last is direct puncture of the epididymis, excretory duct of the testicle. There are two basic types of artificial insemination: homologous insemination or AIH and heterologous insemination or AID. In homologous insemination, the semen is obtained from the husband himself, while heterologous insemination is a technique in which the semen is acquired from a donor. Justifications for AIH and AID. For AIH, first, a husband's impotence where he is incapable of sustaining an erection or achieving ejaculation, which is necessary for fertilization. Second, anatomical defects of a husband's urethra. Third, oligospermia, which is characterized by a low sperm count or a defect in the quality of the sperm. Fourth, some types of spinal injury and certain physical and psychological problems that hinder normal intercourse. Fifth, some husbands who undergo vasectomy contraceptive purposes have their semen stored for eventual use in the future if for some unforeseen reason they decide to have a child. Last, physiological obstructions in the genital apparatus of the wife wherein the sperm cannot reach the ovum in the oviduct. For AID, first, the husband is sterile. Second, the husband is a carrier of a hereditary disease. Third, the wife's oocytes are defective, or she may also be carrier of certain genetically linked disorders. Fourth, the wife's fallopian tubes are severely damaged by sexually transmitted infections.
Application of ethical theories. So here's a good breakdown of how different ethical theories apply to artificial insemination. First, it looks at how different schools of thought approach artificial insemination. First, we got the Roman Catholic view, which is pretty straightforward. They view artificial insemination as immortal. This is because practice separates procreation from the loving conjunctal act within marriage, undermining the unity and fidelity of the spouse and the child's right to convince within the marital bond. Their situation ethics, which is more flexible, focusing on outcome, argues that marital fidelity is based on love and commitment, not just biological connection, and that focus should be on raising a child in a loving family, regardless of the method of the conception. Finally, the Kantian philosophy emphasized individual autonomy, giving couples the right to choose. It emphasized that the decision must be voluntary, mutual, and respect the dignity of both individuals involved, ensuring neither is treated as mere and means to the end. Next, let's talk about the principle of the situation. The ethical principles applied to artificial insemination often revolves around autonomy, justice, and beneficence of non-maleficence. First, the autonomy, respecting the choices of individuals seeking artificial insemination, including single women or same-sex couples. However, autonomy must be balanced within informed consent and awareness of medical risks. Next, justice, ensuring equitable access to artificial insemination while addressing concerns about donor autonomy, inheritance rights, and potential expoliation and sperm donation. Lastly, the beneficence and non-maleficence, promoting benefits and fulfilling the desire for children while minimizing harm to maternal health, psychological impacts on children born through donor insemination. Per our conclusion about the moral issue of artificial inseminations raises complex moral questions that may vary depending on cultural, social, and personal values. For our supporting arguments, artificial insemination can be alleviate infertility-related distress and fulfill their desired parenthood. It expands family structures to include diverse configurations such as single-parent families or same-sex couples. For other critical concerns, ethical dilemmas regarding donor autonomy, identities issues for children. Next, risk for commodifying human reproductions and treating individuals as means to an end rather than ends in themselves. Potential distribution of traditional family dynamics in martial bonds.
Survey results. Here are the questionnaires. These are the responses. For the summary of the results, 6 nursing students responded to our survey. Our survey intends to examine future nurses' knowledge and learnings about the moral issue of artificial insemination. According to the responses, most respondents are somewhat familiar with the moral issue of artificial insemination.